Committee, and we're going to hear one bill today, Senate Bill 888. And Senator Washington, the floor is yours whenever you're ready.
Thank you, Madam Chair and committee members. This is a bill that we passed out of this committee last year. It's very simple. We do have in the state of Missouri a pregnancy-associated mortality review board. It is made up of a variety of folks. We are asking one in this bill because of the variety and diversity of those women who are losing their lives, that we expand this board. And we may need to do, after speaking with the department, to increase the number of members, but we want to have folks on this board that are from all parts of the state. And right now we do not have that. And those areas that are most missing are the areas where our maternal mortality rates are the highest. As you are fully aware, Missouri is in the top 10 in the United States and have a higher mortality rate than many third world countries. In fact, we are the only state whose numbers actually increased over the last year, and so we need to work on bringing that down. And the second thing this bill is asking is that as you collect that information, that we disaggregate that information a little more so that we can fully study what are the commonalities or differences between those who are losing their lives. And so we're asking to disaggregate that by the race, ethnicity, language, nationality, age, zip code, and when they started prenatal and postnatal care. The department actually doesn't like this. They think it's too much information. However, these are the same things that we use when we determine free lunch, when we determine services that are provided through the census. This is nothing different than what the census already asked. And we, as a state that is severely suffering from both maternal mortality and infant mortality rates, need to be a little more focused while we take that $4.3 million that the governor put in this year's budget to adequately study how to fix the problem. With that, I'll take any questions.
Thank you, Senator Washington. Any questions? Seeing none, we'll have your first witness come forward. Please.
There are a few witnesses. They can, in support of the bill, we have a person from Health Forward in Kansas City.
Terrific. If everyone would remember to fill out their witness form and just leave it on the desk, we'd appreciate it.
Good afternoon. My name is Robert Gibson, Policy Impact Strategist with Health Forward Foundation. Health Forward Foundation is a nonpartisan, nonprofit, public charity with 501c3 designation. Our service areas in Missouri include Jackson, Lafayette, and Cass County, and all of Kansas City, Missouri, including portions of Clay and Platte counties in Missouri, and then also on the Kansas side, Wyandotte, Johnson, and Allen counties. Every day we work to support and build inclusive, powerful, and healthy communities characterized by racial equity and economically just systems. I'm here today to testify in support of Senate Bill 888 regarding the modifications to the Pregnancy-Associated Mortality Review Board, specifically as it pertains to the deaggregation of data by race, ethnicity, language, nationality, age, zip code, and level and timing of prenatal and postnatal care. Health Forward supports this bill as this helps to improve maternal and infant mortality by giving health providers the data and information to understand disparities related to the issue and improve outcomes. Currently, Black babies and mothers in Missouri have higher mortality and mortality rates than their white and Latino counterparts, according to data from the United Health Foundation. Disaggregating data by dimensions identified in the pieces of this legislation can better connect mothers to prenatal care, birthing facilities, and postpartum services, according to a joint report by the Robert Wood Johnson Fund and the Urban Institute. This will help to improve maternal health outcomes by closing gaps in prenatal care throughout pregnancy and the key months postpartum. When data are available on a disaggregated basis, we can better target resources and design and implement programs that have the most meaningful impact on expecting mothers and those who recently give birth. This again will ensure a more efficient use and investment of resources to improve important health outcomes. Again, Health Forward stands in support of this bill to help Missouri mothers and their families have healthy, meaningful, and productive lives. I'm here for any questions you may have for me, and I'm available to provide any resources. Thank you.
Thank you very much for your testimony. Any questions for this witness? Thank you for being here.
Thank you.
Next witness in support.
Good afternoon. I'm Kimberly Costello, CEO of the Doula Foundation. We are a nonprofit, community-based doula organization that has been serving Southwest Missouri for 23 years. We'd like to thank you for having us this afternoon. We are in support of this bill and the Pregnancy Mortality Review Board because of what we do as community-based doulas. So I'll want to speak on behalf of the impact that community-based doulas are having on maternal health outcomes in Missouri. Doulas are professionally trained birth and postpartum support professionals that are non-medical, non-clinical physical education, and emotional support throughout pregnancy, childbirth, and early parenthood. At the Doula Foundation, as a nonprofit organization, we are community-based doulas. A lot of people still don't have an understanding of that profession, but we are certified and credentialed birth and postpartum doulas who work with at-risk families. At the Doula Foundation, we work primarily with Medicaid moms in Missouri. And as you know, in that PMAR report, it reported that moms in Missouri that are on Medicaid are 8 times more likely to die of a pregnancy-associated death. And so a lot of the things that we are addressing in those numbers is something that the Doula Foundation, as a community-based doula, those are things that we are addressing. We work in collaboration with the medical professionals at the hospitals and 40 other social service organizations and agencies that we partner with at a pregnancy and maternal mental health coalition in Southwest Missouri. And in that partnership, we are addressing social drivers of health that are contributing to these pregnancy-associated deaths. We provide trauma-informed care for moms that are suffering with domestic violence, poverty, homelessness, single-parent homes, sexual violence, extreme trauma, and are at risk for entering into the foster care system. Doulas empower moms through evidence-based education with home visitation and 24-hour on-call service supporting and surrounding the birth and continuous labor support, which actually provides also case management and connection to vital community resources. And now that we have expanded Medicaid in Missouri for 12 months, that's a vital role of a postpartum community-based doula. And we are also certified perinatal community health workers. And so we can go and address those pregnancy-associated deaths in that 12 months postpartum and really impact maternal health outcomes. MoHealthNet and insurance carriers do not cover this doula care service at this time, and our low-income and impoverished moms are the ones who are at risk and need these gap services absolutely the most. What I'd like to address in Southwest Missouri is that our rural communities, like Southwest Missouri, are addressing rural disparities, which actually attributes to a lot of the pregnancy-associated deaths. When you have lack of access to care, we also in Southwest Missouri are battling the highest rates of child abuse and neglect, domestic violence, families in poverty, and many moms are driving more than 2 hours to see a doctor or give birth to their child. Research indicates that the doula, community-based doula, is a critical role in helping gain access to health care, reduce barriers to care and transportation, reduce low birth weight and preterm deliveries, NICU admissions, C-section rates, and mental health concerns, as well as preventing child abuse and neglect and families and children entering into the foster care system. If you have a doula-assisted mom, They have lower healthcare costs, and it is saving states millions of dollars. The Public Health Washington University stated that doula care was reported to also decrease the use of pain medication during labor by introducing comfort measures, stress reduction techniques, improving breastfeeding rates, and they are able to decrease urgent care and emergency room visits in that first year of life, which improves health outcomes and reduce costs. In the past 23 years, we want to advocate and educate on what a community-based doula role is so that we can broaden the access to help in our communities, especially provide those gap services and home visitation, which will improve these numbers. If there were more programs across the state like this, that would help. In the past 23 years, again, the Doula Foundation has provided more than 340,000 hours of support and education that have been provided as a free service to over 30,000 individuals. That results in 97% of our moms that are avoiding preterm and low birth weight deliveries. And in our 23-year history, we have never lost a mom to a pregnancy-associated death. We are living proof that the right professional, evidence-based training and certification, education, and support, we can impact these lives tremendously for generations to come. We thank you for your time, and we are happy to provide statistics or anything that might help with any kind of hesitancies over the bill, anything that we can support. We would love to be a part of that. Thank you.
Thank you for your testimony, and you provided an amazing statistic, not one mom lost. That's terrific. Thank you. I don't have any further questions. Anyone else here to testify? Oh, and please remember to leave your
Yes.
witness. Perfect. Any other witnesses here to testify in support? Seeing none? Anyone here to testify in opposition? Anyone here to testify for informational purposes? Please. Whenever you're ready.
Thank you. I submitted a witness testimony online. Is that okay?
Yeah, that's
okay. Good afternoon. Thank you for the opportunity to speak today. My name is Dr. Rika Yu. I'm a policy fellow with MOST Policy Initiative, which is a nonprofit organization that provides nonpartisan research briefs to the Missouri legislature. Today, I'll be giving informational testimony on research briefs we've published in the past regarding infant mortality, maternal mortality disparities, and postpartum medical coverage, which these documents have been passed out to the committee for reference. So nationally and in Missouri, infant mortality rates have decreased between 2005 and 2019. However, both nationally and in Missouri, infant mortality is highest among Black individuals. In 2018, the 5 leading causes of infant mortality in Missouri was birth defects, preterm birth weight and low birth weight, unintentional injuries, sudden infant death syndrome, and maternal pregnancy complications. These causes occur at higher rates among minority populations compared to white populations. For maternal mortality, Missouri was ranked 44th in the nation, averaging about 40 maternal deaths per 100,000 live births. And in Missouri, maternal mortality rates are higher for ethnic minorities, with Black Missourians having about 90 deaths per 100,000 live births. The most common cause for maternal mortality during pregnancy and shortly after is complications with blood pressure and hemorrhages. Chronic conditions such as diabetes and heart disease increase the risk of complications during pregnancy and postpartum, and these chronic conditions are more commonly affect ethnic minorities in Missouri. Socioeconomic factors influence both infant and maternal mortality rates, as resource availability and discrimination can affect healthcare access. Nationally, Medicaid expansion to cover 12 months postpartum is associated with a 25 to 40% reduction in maternal deaths, as well as an increase in maternal health care use, management of chronic or pregnancy-related diseases, and prenatal nutrient use. With that, I'll answer any questions you have.
Thank you for your testimony. We received your handouts, and we'll make sure that all the committee members receive those as well. So,
Thank you.
seeing no questions, thank you for your testimony.
Thank you.
Please leave. Oh, you submitted one online. Thank you. Ben, would you mind testifying? I have a few questions. Good old-fashioned voluntolding right there.
So I painted the house last week. Yeah, Ben Terrell, Department of Health and Senior Services.
Thank you.
Voluntold to be here.
Thank you. I guess just to follow up on a comment made about the department not liking this language, can you speak to any concerns that you have with it sounds like the disaggregation piece?
Yeah, for starters, I want to be clear. We do not take a position one way or the other on this legislation. I don't want anybody to think that we're opposed to it or anything like that. And I also want to emphasize that we take this very seriously, and maternal mortality and infant mortality is also a continue engaging on this.
Okay, thank you. Any other questions for this witness? Thank you. Now, I also am going to make you fill out a witness form.
I would have forgotten, so
I'm
I
sorry,
appreciate
your
that.
least favorite person today. I'll take it. Any other witnesses who'd like to testify for informational purposes only? Seeing none, that will conclude the hearing on Senate Bill. Or do you have any closing remarks, Senator Washington?
No, ma'am.
That will conclude the hearing on Senate Bill 888, and we will go ahead and take roll call to establish a quorum.
Senators Arthur,
Here.
Williams, Carter, Moon, Mosley.
Having established a quorum, I will make a motion to bring up Senate Bill. Oh, sorry. I will make a motion to go into an executive session. Do I have a second? Thank you. We have a second. All those in favor say aye. Aye. Any noes? The ayes have it. I now move that we vote Senate Bill 878 out of committee do pass. Do I have a second? Thank you. This is the bill we heard last week relating to child custody and paternity actions. So Senator BECK's bill that this committee has voted out previously. Is there any discussion? Seeing none, please call the roll.
Senators Arthur,
Aye.
Williams, Carter, Moon, Mosley.
By your vote of 3 ayes, 0 noes, you have voted Senate Bill 878 out of committee do pass. I now make a motion that we move out of executive session. Do I have a second? All those in favor say aye. All those opposed? The ayes have it. I now make a motion that we adjourn. Okay, all in favor? Aye.